So hi, I'm Dr. Ron Miller of Pursuit Physical Therapy, and I'm giving Richie, who's a third-year doctor student today, the opportunity to ask me questions about business, physical therapy, why I started a cash-based clinic, and we're just going to go from there. So Richie, ask any questions you like.
So I guess I'll start off with asking, what caused you to want to open a cash-based physical therapy practice?
This is actually more of a longer question, or I could go on for hours about this, but I know the specific day that it hit me. I was in a standard care clinic. I was being triple booked within the hour. And I remember I was doing some manual therapy with a patient, and I had another patient doing exercise at the same time, and my third patient was walking in the door. And I knew that I could have helped that patient I was doing manual therapy to, and it just hit me. I was like, what am I doing? I can't even provide the quality care that this patient needs just because of the system. So then I started thinking, I was like, why am I getting burnt out, seeing multiple patients every hour, being overworked and underpaid? There has to be a better way. So I started researching about kind of the future of healthcare and the future of physical therapy, and I started studying it, and you can start to predict trends and foresee what's going to happen in the future of healthcare and what's going to happen in the future of physical therapy. And when it comes down to it, I got intrigued I saw physicians were going to concierge medicine, and they were going cash-based practices already, the ones that weren't being bought up. And it got me thinking, why can't we do this in physical therapy? So I started reading it, researching it, and I feel that if you can provide true quality and value to healthcare, you can have the opportunity to open a cash-based clinic. And then I went with it. I believe in physical therapy. I feel that I can truly help people and create value in healthcare. And then I opened my cash-based physical therapy practice.
Kind of going off that question, how do you see the changes in healthcare affecting physical therapy in the future?
In standard care?
Yes.
In standard care, now this is just my viewpoints on this. I kind of foresee standard insurance outpatient physical therapy. They're going to be on the totem pole. I use that saying a lot because I think that it's going to be a part of the ACO model. Many private practices are going to be bought out. And I see that at the end of the ACO model, PT is going to have its place. I don't foresee it having more of a direct access kind of model. It's going to be after the physician, after the specialist, after the imaging, then they're going to have PT, and you'll be a part of the ACO model. And again, you're going to run into the same problems as what physical therapy is running in today. Reimbursement is going to get less and less. You're going to be forced to see more and more patients. And then in that ACO model, or that bulk charge that's going to the group, you're going to get the remaining balance of it. So yes, you'll still be able to thrive with it because you'll have to show good outcomes, and you'll be rewarded for the good outcomes. So what I mean is, say like there's $1,000 left for this patient who has a total knee. You're going to be rewarded. The faster you get that patient better in the fewest amount of visits, the more money will come in to you in the group. So we're going to shift away from billing multiple units per visit and overbilling, and more visits means more money. It's going to be more of based on outcomes. So you're going to get rewarded better if you can get that patient better quicker in fewer amount of visits. So in the standard insurance type of model, I think that's where physical therapy is going. It's going to be hard to have a private physical therapy practice and still accept insurance. Medicare's going bankrupt. Insurance companies are having more and more limitations, denying claims, decreasing reimbursement. I just got the email, which you saw a little bit ago, that there was a workman's comp guy trying to negotiate a $58 treatment, which I showed you. So is your time worth $58 and stuff like that? So I don't think it's going to be hard for private practice to survive healthcare reform and even survive in private practice. So that's where I kind of view outpatient physical therapy, if they stay in the insurance-based model, it's going to go that direction.
So with these changes, what would be your best advice to me as a student about to enter the job market to kind of put myself in the best position to succeed personally and professionally?
Number one, I recommend students to get good quick. You know, if you can help people and show value, I keep on saying that, but if you can help people at a cheaper rate, get faster results, solve the problem that's causing their pain, you're going to be in business, whether you work for someone else or whether you open your own clinic. You got to get good quick. You got to be able to get the easy patients better quicker. You got to be able to solve the complex cases. Okay, so what I recommend, if someone knows what they're going to do, I'd go into a residency or a fellowship. Now, you will have to commit like a year or two of that, but you'll learn a lot, you'll get good quick. That's kind of what I did. I wanted to get good quick, so I did a residency. Another option, I mean, not everyone has to do a residency. If you can, number two, if you can find a good mentor, they'll guide you like along that route. So you may not have to take the pay cut, might have to have all the didactic work, but if you found a good mentor, that would also help. Three, and then, you know, after you get good quick, my recommendation is to start saving money. Now this is off topic, but learn how to manage money. Pay off your credit card debt, not all of your student loan debt, but make sure after you get good quick, pay off the credit card debt, learn how to manage money and save money. And then after that, you're going to create an opportunity for yourself where you'll have a great base of knowledge. You'll be an expert clinician, whether it's in sports or manual therapy, orthopedics, even geriatrics maybe. And you won't have a lot of debt except for the student loans, probably. That's what I have still. I'm a part of that group too. And then you'll create an opportunity for yourself where either you'll venture off into a private practice, you know, and maybe even a cash-based clinic and show great outcomes and help a lot of people, or you can still work for someone and do that same thing and create more value for their company too. Whether it's through marketing or a management position, stuff like that. But my first two things that I recommend for students is to get good quick, because if you can show good quality, good value in healthcare, you'll survive. So that's what I recommend. We need to start specializing. We need to be the experts in orthopedics, manual therapy, etc. And if you can get good quick and be an expert, Malcolm Gladwell in his book Outliers says it takes 10,000 hours of practice. So at that 4 to 5 year point, when you're that expert, or even faster after a residency, you'll be safe and you'll be good career-wise, salary-wise too, if you're an expert in that field, helping a lot of people and showing great outcomes, and then you'll be fine. But my recommendation is get good quick, either through a residency or fellowship or through a mentor.
So coming here on Clinical, I obviously checked out your website and watched a lot of your videos, and I have to ask the question of why are you so monotone with videos?
My wife actually pointed, I just got called out by a student. Anyway, my wife actually said that same thing. She was like, Ron, you have to drink a Red Bull before the videos. You're so monotone. I was like, well, part of it is I'm just going for the Elon Musk and the Dr. Ben Carson kind of approach of giving a lecture. Honestly, I think I'm monotone because my brain is going like a million miles a minute half the time, and I just go into what's comfortable for me, and I end up going into that monotone voice and stuff like that. I've actually had multiple people tell me that you need to drink a Red Bull before you do your videos. But to me, I'm focusing on the content, and I want people thinking. I don't want to be like dressing up in a pirate's hat, jumping up and down saying, buy this product. And I don't want to be that salesperson approach type thing that just does something stupid to get someone's attention. And then I don't feel that I need to do that. Like, I feel like music artists nowadays just do something so bold and out there just to get everyone's attention to overcome the lack of true talent. So what I'm hoping to do is I'm really focusing on the content and get people thinking. I'm trying to get physiotherapists to think outside the box and really think of a new way of doing things. So I probably end up falling into this monotone approach. It's just the way I am. I don't feel like I have to drink a Red Bull and act stupid on TV or on a video to try to get someone's attention. I probably do have to add more energy into it a little bit, but most of the time I just go into it because it's my comfort zone and I'm just thinking all the time and I go that way. But thanks for the call out on that one.
What would you say right now are really your biggest obstacles as a small business owner, private practice, cash base?
Your number one thing is to have the right mindset. And people always say this, and you hear people say this all the time. You have to have a business mindset. When you first start a business, you're going to be really happy, you're going to be excited and ready to jump in. And they're going to start hitting some hardships. Oh, I can't pay the bills. Oh, no one's calling. Oh, how do I get new patients? And it gets ugly and hard really, really quick. And you have to have that right mindset to keep on pushing through it. And this is where it comes into like fear of failure and fear of going outside of your comfort zone. And that's what they mean by, do you have the right mindset? When you run into a hardship, do you look at that as a failure and kind of back off of it? Or do you run onto this hardship, learn from the hardship, modify, adapt to it, learn from it, and get past it and keep moving forward? That's the idea behind, do you have the right mindset? Because when you open a cash-based physiotherapy clinic, whether you realize it or not, you're a small business owner now, you're an entrepreneur. You have to start thinking like one. We can't keep thinking like an average physiotherapist in the healthcare model and standard care. That's not going to work. That's why physiotherapy is struggling right now. So number one is you have to get the right mindset. Two is learning how to run a business. I've actually had people call me asking me what I'm doing and how I'm doing it. And I ask them questions, okay, step by step, what are some of the problems you're having right now? And there's people who have a cash-based clinic right now that don't even have a website. I'm like, how's anyone even gonna find you? And stuff like that. So learning how to run a business. You need to think like a businessman or woman. You need to learn how to sell. In business, if your business has no sales, you don't have a business. So you need to learn how to sell physical therapy. You need to learn how to market physical therapy. You need to learn how to objectively measure your business stats. You need to learn, Elon Musk says this best, if you're gonna open a business in an oversaturated market with lots of competition, physiotherapy and healthcare, there's 1 million physiotherapists here. Healthcare is an oversaturated market. If you're gonna open a business in an oversaturated market, you have to have a product or a service that's superior. Not great, not just better, superior. Because there's so much competition. So you need to learn, what's gonna make yourself set up way more than your competitors, way more than the hospitals, way more than everything. Your product has to be superior. You have to learn how to do that. So those would be the two main things. And obviously the third hardship is patients, but that goes into marketing. What kind of patients are you trying to target? How can you get people to take action, stuff like that. So I kind of bundle that into marketing. But I would say, number one, as a startup, you gotta have that business mindset to survive. Because in small businesses, I think like 90% of new small businesses fail. So you have to be able to open that small business and thrive. So have the business mindset, learn how to run a business, and learn how to market. Because then the fourth one's going to be getting patients to call and come in. So that's a problem with every physiotherapy practice. But
having just about the exact identical educational background as you, I know that we're not exposed too much to business principles and teachings. How did you on your own go out and learn how to run a business, how to be a successful businessman and entrepreneur?
Well, at first I didn't know. I struggled my first year. It was hard. I have student loan debt. I have a mortgage. I started my practice and I struggled that first year. It was hard. It was almost going back to eating ramen noodles in college almost. I mean, you had to really manage your money, but I was in the right opportunity at the right time where if I was ever going to do it, I had to do it then. Because when you start having kids, when you start having some debt, you can't do this. So I actually recommend students, new grads right out of school, the best time to do it is after a residency or after a mentorship and you're a good clinician with no kids, only student loan debt, credit cards paid off, right there's the time to open up your practice if people are wanting to do it. But another thing is to start reading books. You know, books have all the knowledge in the world right there. It's just a matter of finding time to read them. You know, I started out with personal growth success books so I could get that right mindset. And then I started to read some business books and then marketing books, you know, what marketing strategies are proven and effective. I also started surrounding myself with successful businessmen and entrepreneurs. I started to network and join these groups, and when I found someone who is successful and kind of inspiring, I'd take them out to lunch and I'd start asking them questions and I'd interview them almost. You know, what made you successful? What do you recommend me to do in this? Because any successful businessman who sees a small startup business, they'll always want to help you. You know, they'll always be willing to take a half hour, an hour out of their busy day to help an entrepreneur because they were that a couple years ago. So don't be scared to ask a successful person, whether it's even in physiotherapy or healthcare or anything. I interviewed a person who's a CEO of a personal mini storage. Anyone who I felt was kind of successful, had that mindset, has been there, done that, I'd take them out to lunch, maybe go out for a drink and interview them. And I learned that way. And when you put all those things kind of together, I built my system of my cash-based practice. And I kind of modeled everything I learned and put it towards a physiotherapy model. So that's kind of what I did to learn how to run a business and learn how to market. Read books, get in that business mindset, start interviewing people, surround yourself with successful people, and it'll start to rub off on you and you'll kind of learn that way.
So it sounds like you kind of learned a lot on the go, trial and error. Is there anything that you would have done differently in opening your small business?
I probably would have, that first year, I wouldn't have jumped in so fast. There's things I should have done before I opened so I didn't struggle. And that's what a lot of PTs are doing now. They don't have the resources, or we don't have the training to know what to do to open up a practice. So a lot of PTs are just jumping into the cliff of small business and they're drowning. You know, they're not having a website up before they open their practice. They're opening their practice, but they don't even know the type of patient they want to see, and they're marketing physical therapy. So what I would recommend to do is align everything at first, you know, and then proceed with opening the practice. That's why I designed my business and marketing 101 content. So someone can go say, if you're interested right now in opening a cash-based clinic, you can go to the website, cashbasedphysiotherapy.org. You can get the free checklist that goes over, I think, 15 or 16 steps, what you need to do before you even open. So once you get those things done and you've opened your business, now how do you run your business? How do you market your business? You can have access to everything that I've done in my Business 101 and Marketing 101 courses. So you'll have the blueprint ready to run your business. And yes, it's roughly $1,000 to a $2,000 cost. Now again, most people will look at that and be like, wow, that's too much money, I can't do that. If that's too much money, you're not ready to run a business because you can't think like that. That's going back to that fear of failure, fear to come outside your comfort zone. If you can invest $1,500 or $2,000 and get $10,000 a year later of profit, that's worth it. That's how you got to start thinking about things. So Yes, it is expensive. A lot of people even said that my one-to-one courses are cheap, that I should be charging more. I'm not trying to create more debt for a new business. I just want to provide someone with the opportunity to learn from it and to generate profit. Okay, so I thought that was a reasonable cost for it, and it will give you the blueprint to go from, spending like $2,000, but my goal with that is to get you to a point where you're generating $10,000 to $15,000 of profit after 1 to 2 years. That's what you have to think about it as. So that would be kind of the one thing that I would do, is kind of make sure that I'm ready before I open my practice, because that first year was hard, which that's how it is for a lot of businessmen. That's why 90% of small businesses fail, because they're not ready. They don't know how to run a business. They don't know how to market. So that's my goal of cashbasedphysiotherapy.org, is to give other physiotherapists who want to open a cash-based clinic the opportunity to thrive in a small business. So I get to help other PTs survive healthcare reform, learn how to run a business, and then there's even a third step when someone's at the point where they're fully plateaued, they're generating over $10,000 of revenue a month, and you're overworked. You have that term monkey mind, where your brain's just going a million different miles a minute, which that's what mine is. You even have the opportunity to go to the next level now of the local domination and growth package. So when it's time, if your dream is to have a multi-clinic practice and to have a team of great physiotherapists, you have the opportunity now. Let's take it to the next level and go from there. But startup, business 101, marketing 101 will teach any physiotherapist how to run a business. And then their work ethic or their effort is going to dictate whether they can go to the next level or not.
So you mentioned a lot of options for physical therapists that are looking to open their own business, but what's next for you personally with your business?
My first goal is I want to create a team of expert therapists. So after you complete a residency, I'll be calling you. But what I want is a great team of 3 or 4 therapists, expert, board-certified physiotherapists, specializing in orthopedic, manual therapy, SI joint, whatever, and showing better outcomes in standard care. So once I develop or design that team, which I'm halfway there, then I want to expand into multi-site clinics and stuff like that, opening other clinics like a Pursuit North, a Pursuit South, and venturing into other cities. But first, my first short-term goal, actually my first goal for 2016, is to plateau and reach that 3rd or 4th therapist. So that's my goal, my next one. Long-term wise, I want multi-site clinics. But first I have to reach that first one. So I'll be calling you after you do a residency.
Keep my phone open. All right, I think that's all the questions I have for you at this point.
Perfect. Well, thank you. If you ever think of more questions, you can always email me. But the purpose of this was just to get a student's kind of perspective. What questions do new grads, or what kind of questions that they have to ask, or to get you thinking a little bit on the future of physiotherapy and what to do, what's going to create success for you. Now, we can share this with other people, whether you want to open a cash-based clinic or whether you're a new grad and you're contemplating whether you want to do a residency or not. Because I think the main thing is you got to get good quick, and you'll be able to create value for people. Because in the big picture, if someone with low back pain comes for you for treatment and you can get them better and fewer visits for cheaper, you will have value. So now any student or anyone else that we can share this with has some questions to answer or ask, and they can be thinking of this, of what's the next step. So thanks for interviewing me, and then and we'll go from there. If anyone has any questions, they can go to the website. It's cashbasedphysiotherapy.org, and we can go from there. Thanks.